When I look at my father, all I want to do is like climb a mountain, because he was like the strongest man that I know. And it hurts, to see them like that. He was born in July 1940 in Lahore, Pakistan. He was a boxer during his time and a very keen rower. And he continued to love sport all his life. He still loves sport. He struggles to walk. He struggles to put his clothes on. Fortunately, in the last 6 months, the dementia has really affected his speech. So he cannot get his words out now. It's reached that point that we are just taking clues from knowing his personality and knowing his ups and downs.
My father-in-law is hard of hearing, has been diagnosed with lymphoma. He's been here and worked here all his life, but his English level is still quite basic. He can't, therefore, speak to the GP on the phone. I'll speak to him in Urdu, which is his first language. As he's hard of hearing, he just finds that easier to understand. So it's always second-hand, where you're the person in the middle trying to relay information in both directions. And when health professionals speak, there doesn't seem to be that understanding to slow down. The pandemic definitely made life a lot harder. Unfortunately, my father-in-law needed to go to hospital because he was unable to breathe. None of us were able to go with him, and because he hadn't been able to explain that he was a Muslim and required a halal diet, he just ate what he was given, and there wasn't that understanding. And you just feel so helpless at that time. Just thinking back makes me shake, because we were so scared, literally locking ourselves away into one room while somebody else was disinfecting everything, using separate cutlery, separate crockery, just trying to protect the vulnerable people with us. Sometimes it's just easier to do whatever you need to do than trying to find support services. That's just so much harder to find out about.
Whenever I've accessed social services, they do pass you from one to another, to another, to another, to another agency. Just simple things like getting him aids to walk with, or what we're entitled to. Are we entitled to a wheelchair? All of these things have taken months. Even when I rang the emergency line, they were given an appointment 7 weeks later. By that time, he'll have numerous other problems.
We've had a lot of experience where he's passed around from one expert to the other. You've got a 5-minute appointment where you can talk about one thing. How can you talk about one thing when a person suffers from so many different things?
As a British Muslim, I think in my own community, we don't talk about these issues as much as we should. I mean, certainly when people ask me, how's mum and dad? The default is to say they're fine, but they're not fine. Every single day I'm in the hospitals, and even when I'm not, in between juggling my own responsibilities, there isn't a day or a night that you don't feel that anxiety. Parents are held in great esteem in Islam. They raised you, and they raised you in love.
Caring and respect for all family members is paramount. It's instilled in me, it's instilled in all Muslims I know, and it's in my children.
So much of it is left to the families, I think, because they are filling the void for social services. Carers and children to our loved ones need help, because there is that ingrained belief that your children will look after you.
They're so reliant on us. And yet how we can help is so limited.
A lot of Muslims, we talk about death quite openly, but we don't talk about the end of life. There's a lot of stigma around it, that people don't want to admit how hard it is, because they want to just say we're coping, we're fine, they're fine. But actually, I feel like I'm drowning. That's the honest truth.
We believe that Sobia and Amber's experiences may prove to be all too typical for British Muslims with palliative care needs during the COVID-19 pandemic and beyond.
Our follow-up research is ongoing, but right now we're making some key recommendations to help palliative care providers offer the best, most culturally appropriate support to British Muslims.
You can find out more and read our report and its recommendations in full on our website.